Hi, I'm Dr. Hansler. I worked as a research physicist for GE Lighting for more than 40 years. Did you know that blind women have about half the incidence of breast cancer as women with normal vision? This was observed way back in 1990. More recently, it was found that there are two types of blind women: those who are totally blind and those who still respond to light enough to control the production of melatonin and the setting of the internal or circadian clock. The totally blind have about half the breast cancer incidence of those who still control melatonin by exposure to light. Light exposure stops the production of melatonin. Did you know that when mice were injected with a drug that caused them to develop breast cancer, the ones raised with 16 hours of light each day all developed breast cancer? The mice that were given the same drug but raised in 16 hours of darkness each night did not develop breast cancer. The difference was thought to be the time that melatonin was being produced. If the mice raised in 16 hours of light were given melatonin in their drinking water, it reduced the number of cancers. Humans can produce melatonin for 11 or 12 hours a night, but only if in darkness. When we evolved, we had 12 hours of light and 12 hours of darkness. When the sun came up, it reset our circadian clock. 12 hours later, the clock would signal the pineal gland to start making melatonin. Edison's invention of the electric light changed all that. Most people are in darkness only 7 or 8 hours a night, many for much less. Exposing the eyes to light in the evening not only stops the flow of melatonin, it also resets the circadian clock. This constant resetting of the clock is also believed to be damaging to health. Hundreds of experiments have been done, and they all point to the same conclusion. Using ordinary light bulbs in the evening and during the night increases the risk of breast cancer. Fortunately, there is a way out of this problem. In 2001, it was discovered it is mostly the blue rays in ordinary white light that cause the problem. Light bulbs that don't make blue light and eyeglasses that block blue light are available on the internet. By putting on the glasses in the early evening, the full 12 hours of melatonin flow can be restored. Using low blue light bulbs will accomplish the same thing. Great sleep is a valuable side effect. Putting on the glasses in the early evening starts the flow of melatonin. By bedtime, there is plenty in the blood, so sleep will come quickly and deeply and be more refreshing. Who says we can't have it all? Great sleep and reduced cancer. That's the title of my book. You may want to read it. And thanks for watching this video.